Serenity is not freedom from the storm. It's peace amid the storm. It's one of the reasons that we have been so aggressive in trying to figure out what we can do and what we should do so that each of us are actually empowered as we make these decisions. And it does feel a bit more calming when we have some parameters about what I can do as a association's legal counsel and what you can do as the association's managing agent in dealing with these crises as they are coming up on a day-to-day basis. First thing that we should be doing, and I'm hoping for the most part that this has already been done, we have to close the amenities, the gyms, the pools, the recreation centers. We know that there was an incredible amount of resistance to doing that, both in planned developments where we have community centers and recreation centers, and in our high-rise buildings as well, mid-rise as well, in our Long Beach area, which probably affects a fair amount of the Horizon properties as well. Our philosophy is if the local and state and federal governments are saying those facilities should not be open, then we're not going to have them opened as well. It's almost impossible to maintain the proper amount of social distancing that will allow us to use the facilities without potentially having the spread of the coronavirus, which leads to COVID-19. Closing down sit-down restaurants. There are not a lot of communities that have sit-down restaurants, but there are a fair amount of them between all of our associations throughout the state. And we are certainly saying that those restaurants are the same as all other facilities in the state that had to be shut down as well. It's a different story. If you have takeout, you have to actually look at the community and the impact that the takeout and delivery food service would have on the community and the potential risk that we would be dealing with if in fact somebody got sick coming in or requesting the delivery of their food. And then we have the postponement of non-essential work. I've had board members say, well, what are we supposed to do with garage doors being left open? Well, if you see it, you can let management know, but that's not what we're going to be worrying about right now. We're going to be worrying about the health and welfare of our communities and the residents, including our owners in that community. Talking about residents, we usually say that we deal with the owners and it's the owner's responsibility to deal with their residents, whether they're tenants, family members, whatever. And that still holds true, but for notifications, we want to absolutely make sure that if we have contact information for the residents and we don't have an ongoing level of communication with our owners, give that information to the residents. We are trying to make it so that associations understand that we are responsible for the it, which is the association and its common elements. And we really want to present this in such a way that owners and residents understand you are responsible for your health and safety and those of the other occupants in your unit. And the only way that we can effectively go through this process and hold them accountable for that and not accept that burden onto us, the association, is by giving them information. And part of that is by postponing that non-essential work. So what do we do if someone has been affected? We've been reported that there's a COVID-19 illness within your community. The first thing that we need to do is find out where that person is. Are they in the hospital or are they home? Because we know that in our communities, hospitals and our regional hospitals, they're overloaded. You have to be living in a cave not to know that that's what's going on. And unless you're in a life-threatening position, they want you to stay at home. And we have two phrases that we're bantering about: isolation required and quarantine required. So we are isolating ourselves by the stay at home order, and quarantine is required when you have the COVID-19 virus. So if you've been exposed to the virus, you're going to shelter in place. That's also a term that we're getting used to. And the shelter in place requires somebody for 14 days to stay in their home so that they do not take a chance in exposing somebody else to the COVID-19 virus. So they've been exposed but don't have it themselves. We're now finding out that in fact they can be carriers without having the symptoms themselves, or their symptoms can be so light they may think, well, I'm really okay. I have no problem in doing this. But the idea is that you have to be home in any event because there's a 14-day incubation period. If somebody has the COVID-19 virus, uh, the stay-at-home order for them is different. So they have to be quarantined for the period where the virus is active. And then their stay-at-home period may actually be shorter than the 14-day incubation period. And that's because the CDC, is the Center for Disease Control, has issued its mandates, and that is that if you have COVID-19, you need to be remaining in a quarantined environment until 72 hours pass until you no longer have any symptoms. And any symptoms could be the coughing symptom or the chest pain symptom, the difficulty with breathing symptom. When you no longer have any symptoms, you count 72 days thereafter, and then you will be out of quarantine. So one of the things that it's really important that we are dealing with is knowing that we have this information and requesting owners to provide this information. There seems to be an incredible amount of stigma, if you've been dealing with this at all, that is attached to the realization that somebody actually has been exposed. And we want to make certain that at all times people understand that we are including them, not excluding them by this information. By asking your owners to tell you whether or not they or anybody in their household have been diagnosed with COVID-19, we are going to assure them that in fact they are going to have the protections of their name and their home or unit number. We're going to abide by both the Americans with Disabilities Act, which do not in any way discriminate against persons with a health-related issue. And yes, you've heard me speak before, and we all know that we say that the Americans with Disabilities Act do not apply to most associations, and it does not change that, except we know from governmental authorities that they are going to hold us accountable for not violating the disability part of ADA as it requires and relates to disclosure of those people that are actually affected by COVID-19. And we also need to make certain that we comply with HIPAA requirements. One normally would think that HIPAA requirements are those that are bound by the medical profession, the doctor, the nurse, the radiologist, all types of doctors, medical personnel. But it appears that we are picking up that obligation to not make any exposure of the names and the location of the unit or home owner. It's extremely important that we are aware of the fact that we have those protections and encourage owners or residents to relay that information to us. Management is who I'm referring to here, so that you are best able to speak with your boards of directors and provide the protections that we need to provide to our associations. So the big issue is meetings and committees. I think what we had is a lot of reactionary cancellations, and now real life is setting in. I've spoken to a number of different firms, and some of them are saying our boards aren't meeting. They're not dealing with any particular work on an ongoing basis. That's going to change, I promise all of you. We know that LA County has an order that restricts any gatherings between 2 and 9 people. And you can only have a gathering of 2 or 9 people if you maintain physical distancing. I'm really trying to use physical distancing as opposed to social distancing, because the CDC has said they want us to use physical distancing. They want us to be social. They want this interaction where we can communicate in alternative ways. But these having a meeting in person by a board is for the most part really difficult. Where is it going to happen? How are we going to guarantee that physical distancing? How are we going to guarantee that there are hand washing facilities and sanitizers? We are rather asking that our boards agree to meet electronically. They can agree to meet telephonically, video conferencing like this. It is safer for them. It's safer for you as the managing agent, safer for us if we've been invited to those meetings. And I think this is a really important thing for all of us to understand together, that we have this obligation to continue the business of our corporations, but really we need to do so in a really smart way. And a really smart way for us right now is either postponing, but we can only do that for a period of time, delegating some of the responsibilities to a committee of the board of directors, which of course requires some meeting. And then, as I said, teleconference and video conference. This week's nightmare is the postponement of annual elections and how we do that. We do it like we do when we don't get quorum. We say that we're postponing the annual election. We are not accepting any more ballots during the cutoff date. We're dealing with an international crisis, and holding our annual election and opening those ballots in a place where everybody can see the contents doesn't really seem like it should be at the top of our agenda. We do have a statutory provision that says our board members hold their position until their term is over and their new replacement director has been elected. So we're not in harm's way continuing to do that. Admittedly, that advice notwithstanding, we have some associations that think it's critical that they proceed with their annual election. We have found some election companies that are willing to be videotaped, come on site and be videotaped. The problem that I have with that is we still are going to have some social gathering in order to accomplish that. So when we do the question and answers in a while, I want to address that issue and really find out what all of you are doing. Video conference, ballot opening, all of that will have to be captured on tape or film or live if we are actually going to be videoing the opening of those envelopes so that we can comply with Davis-Sterling. Going back to the board and committee meetings, when we are recommending telephone conferences, if a board is not comfortable with video conferences, we know, and I will say this a few times, that the Davis-Sterling Act requires that the board members be able to hear each other, and that meets the deliberation part of the meeting. And we also know that we are supposed to have a location on site where a board member or the managing agent goes so that any homeowners that want to attend that meeting could attend on site. And I know that that's a requirement in the statute, and I'm saying that's just something we're going to clean up later. If we have a general session board meeting, we are going to deal with that board meeting, and we are going to allow all of the homeowners to have the call-in number. We're going to notice that board meeting. They will have the opportunity to speak during homeowner forum during that meeting, but we are not going to have somebody present on site during the meeting. Is that strict compliance with the statute? Clearly not. Is it in the spirit of the statute? I think it's absolutely in the spirit of the statute. And frankly, I'm disturbed if anybody says otherwise. Assessment collection. This seems to be our big ticket issue. It's really hard, by the way, not to touch your face. This thing about not touching your face, I want to touch my face like all the time while we're talking. Assessment collection, here's the bottom line, and we dealt with this in 2008. We all know this because you're all highly educated community managers, and that is your obligations for your associations are ongoing. They don't stop because there's a pandemic. They don't stop because there's an earthquake or 2008 and the Great Recession. Our obligations as for the association are ongoing whether or not the homeowners are paying their assessments. There's no moratorium on assessments. If the association can run without collecting assessments, then when you created last year's budget with your boards of directors, it wasn't really consistent with the statute, because the statute says you're supposed to create your annual budget and levy assessments to cover the mandatory part of that budget. You may have 10% slush fund for delinquencies or for unidentified line items. Well, that's just fine. But it doesn't mean that assessments are not going to be due and owing. What about interest and late fees? I've seen all these email blasts from different firms over the last couple of days and questions from the managers we have the honor of working with and our board members. Should we just have a moratorium on interest and late fees? Interest and late fees are the carrot and the stick. If you say no one is going to be held accountable for not paying their assessments, then why would everybody pay their assessments when they're thinking that some people will not be paying their assessments? This is exactly what happened in 2008. So the answer is assessments, interest, and late payments are due and owing. If, however, we have people who are unable to pay their assessments or asking for a waiver on the interest and late fees because of their own personal circumstance in response to COVID-19, well, of course, our boards of directors are going to deliberate on their request. Payment plans are something that your collection policy should allow for. We know the state statute allows for it. It requires the homeowner to come to the association. Again, that doesn't have to be done in person, and request from the association's board of directors the ability to pay throughout a payment plan. The problem right now is we haven't even had 1 month of delinquency, but we're anticipating that this is going to be coming. One of the other things that I want you to be mindful when our boards are very nervous about getting their assessments, demanding the assessments, should they let them go by the wayside right now? No, exclamation point, no, exclamation point, is how do we deal with the owners who just can't pay? So we are going to follow our collection policy. We're going to be sending out those late notices like you normally do, and you may add a line to homeowners. If you are falling behind in being able to pay your assessments, please contact your association's community manager, and we will relay any concerns, requests that you have onto your association's board of directors. Again, all of these people are part of our community, and to the extent we're in a position to be able to assist them, clearly we want you to be able to do that. But we can't have a global waiver of assessments. I also don't believe that we can have a waiver of interest and late fees, because it will impact unnecessarily the ongoing assessment collection that you already have in your association. And what are you going to do with all of those things that are in collection where you're waiving interest and late fees for new owners and not waiving them on existing owners in collection? If that is going to happen at one of your associations, please be mindful of the fact that our boards cannot act in a discriminatory or in a disparate fashion, that they actually must be in a position where they're going to really do this the same for all people who are delinquent. We don't want your boards to be in a position where people think they're inhumane, but we have to remember that they were elected or appointed to govern. Somebody is driving that bus at this time, and only one group of people can drive that bus in order to get us to the destination, which is a healthy association on the other side of this pandemic. Remember, we have to treat everybody the same so that we are not going to be exposed to disparate treatment. We want to make certain that each of us understand that we have this ongoing problem. And now I can't see if you're actually seeing me. So let's see what that looks like. Here, I'm back. Can you see me now? Joanne, I'm looking at you. Can you see me? Okay, great. Thank you. We have unemployment at record numbers. We know that. You just have to watch television to know that's true. and that people are applying for unemployment. They're going to receive money from the federal government. They say within 3 weeks it should hit their bank accounts. They're going to receive unemployment if they are laid off or furloughed from their jobs. Furlough is sort of interesting with unemployment. Make sure that each association, if you have on-site employees, that has legal counsel, advises you on how to handle the difference between an actual layoff and a furlough. So let's go to our next slide, which seems to be a little tracking here. Wait 1 second. All right. So maintenance and construction. I think we went through a couple of slides too quickly. So maintenance and construction, you have to figure out right now what's essential and what's not essential. Essential is habitability. I'm on the home stretch of a remodel. I need to inset my toilet and my sink to make my unit habitable. I think that's essential construction. You don't need a crew of 35 people coming through the association's common area to get to a unit where, and this is for condominium associations, which includes obviously townhomes, and we'll use for this conversation stock co-ops as well. That's essential. Doing a remodel that hasn't started right at the commencement of this pandemic and our stay-at-home order, it is not essential. There are some people that will take exception to my saying that. We know that LA County considers the following to be essential. Homeowners associations are actually included in one of the essential exceptions of the 16 exceptions. We are allowed, our firm, because we provide advice to the entity that is entitled to that exception, to exist. Our own office is closed for the most part. We have some personnel on site. We were prepared. We are working hopefully seamlessly. And if you're reaching out to us, that we should be able to get back to you as if we were in the office. But let's look for a second of what the LA County considers to be essential. Plumbers, electricians, exterminators, janitors. Our janitors, we should all be bowing down to our janitors who are cleaning our association's common area, what we call the hot spots, our knobs, our elevator buttons, the panels, the exterior of the elevator, doing the best they can so we can continue to navigate through the association's common area. Carpenters, movers. This movers thing is sort of interesting. We have a number of communities that have said no. No move in, no move out, especially when they have loading dock areas. The problem with that, we have orders that say we have to avoid homelessness. So if somebody needs to move into their unit in order to avoid homelessness, we are going to work with them to be in a position where they in fact can move in. We also know tree service and gardeners and landscaping are also essential businesses. I don't think that means when they say landscaping that you get to put in your spring colors. I think we're talking about creating an environment where there is a health and safety component. If we don't take care of our slopes, we're going to have a situation where we are not in a position to be able to protect the safety of those who are walking by. We have a community with docks, and they have to go and clean the docks because ducks and geese do what they do, and it's definitely a health and safety issue if in fact they can't be cleaned and people are on their morning walk around. We want to make sure that sanitation is deemed to be essential. We have situations with associations that we represent in San Francisco where the stay-at-home shelter-in-place order came before our stay-at-home order in Southern California. And we think this is really a good model for all of our associations. And that is, if the remodel is in existence and the contractor provides the association with information about how their policy, in writing by the way, is to be able to effectuate physical distancing, how their workers will be dealing with their work by wearing gloves and masks, especially when they are walking through the association's common area. And if this is a health and safety issue or a sanitary issue or something that creates a functional home, then we're going to let that work continue. Residential remodeling projects that are partly completed that also have these health and safety components based on the criteria that I just discussed, we're going to let those projects go as well. Discretionary remodels may not start unless it's necessary to restore a home to a safe and sanitary condition. This is not part of the Southern California, Los Angeles stay-at-home order, but this is a model that we're using that we think is really important. And then there is the differential between the association's construction and the homeowner's construction. I ask that each of you work with your association's legal counsel on developing a plan, how we differentiate those two so that we are in a position where homeowners are not going to be saying to our boards of directors, why do you get to do that and we don't get to do that? Again, we are looking for the criteria to be safety, for it to be safe, sanitary, and a functional home. Social distancing, we like this picture because this lets us know what that physical distancing and the social distancing looks like. I just really want to say that we know that everybody's doing their part. I'm thankful that we are all working so collaboratively together. And I'm so happy that we have a thoughtful and a caring industry. See a lot of camaraderie through the different chapters of CAI and social media. It's really important if you see any of those couch time, join this hour during your lunch, that we actually do that. It's really important for us to keep sharing ideas with each other and you as community managers to doing that as well. I know it adds one more to-do list item for you, but I think it's really important to learn what others are doing and sort of be uplifted during this, this time. The World Health Organization came out and, as I said, would like us, I think I said CDC, it's the World Health Organization, would like us to use the phrase physical distancing as opposed to social distancing. And the reason is they want us to actually remain diligent about continuing our social interactions because we need that for the health and safety of everything that we are doing. Please reach out to us if we can be of any assistance to you and your associations during this process.